Since I was 6 years old and I was a little girl, I've always enjoyed spending time with my grandfather. It didn't matter what we were doing. Sometimes we would go to the park, we'd go to the skating rink, we'd go out to eat, or we'd just stay back at his house and just watch TV and relax. It always was just a fun time to be able to hang out with him. You know, my grandfather had so much love and compassion to give to people. He was always willing to be there for other people. He was the type to give you the shirt off his back if he needed it. When he first received his diagnosis in 2020, it was scary, and we had also knew that my grandfather didn't have much time left, so my family made the best of the time that we did have. Healthcare in our country in America is not so easily accessible to many of our families today. According to the West Health Organization, research shows that an estimated 112 million people, which comes out to about 44% of American families, are struggling to pay for healthcare. And the numbers even double that for those who feel that what they do pay is not always worth the cost. A lot of our families also have the issue of either making too much money to qualify for Medi-Cal or Medicaid, but they don't make enough to afford private health insurance. This leaves so many people and families in a bind. When you have a loved one or even yourself and you're diagnosed with an ailment that's going to cost you thousands of dollars to treat, like my grandfather, it is a scary time. Many of our families are having to decide between if they should pay their rent or pay their mortgage or pay for their medications or even pay for their treatments. We even have many people in families that are dying today because they're not able to afford the medication or treatment needed that's going to save their lives. That is why it is important to have life insurance, not just for you, but for your families. Life insurance provides an extra layer of protection to people and their families by guaranteeing financial coverage in case of an untimely medical expense or even death. When COVID-19 had hit our world, it took us by storm. Many people lost their loved ones due to this disease. Many people couldn't afford the treatment and couldn't afford to continue to pay for the treatment. So many people have passed away as a result. My grandpa unfortunately did not also have the medical coverage needed to pay for all of his treatments. Matter of fact, if it wasn't for my great-grandmother who put some money aside to help in case of emergencies, my grandpa wouldn't even been able to afford his funeral. My grandfather would still be in the morgue today. My great-grandmother, who had also passed from the same disease, had wanted to at least leave some kind of protection for her children in situations like these. My grandfather's medical costs were too high for our family to pay, so when he passed, the money that was left by my great-grandmother was enough to cover his funeral. As a result, this spared my family the financial burden of having to also pay for the funeral, while also having to pay for his medical bills. If you or a loved one find yourself facing these same predicaments, ask yourself 3 questions. Do you have a backup plan of action should something happen to you, your children, your spouse, your parents, your grandparents, or your grandchildren? Do you have any kind of coverage or protection for your family at all? If you answered no, what kind of protection and coverage are you seeking for your family? If you answered yes to any of those questions, send a text message to the number below at area code 760-628-8452. Speak to licensed agent Maxine Telford-Wolfe about your concerns. She is available now and ready to take your questions. Convey that you want to know more about earning money from a policy that is tax-free and allows you to access your money without penalties while also still providing you that coverage that you need, also while you're still alive. Disclaimer: Agent Maxine Telford-Wolfe is licensed in the state of California.